Hey folks, my name is Carl Bonnet. I'm the medical director for Klarisana. I'm going to do a quick video on the concept of psychedelic medicine, just from a conceptual level. So when we're talking about ketamine and the use of intramuscular ketamine to treat anxiety, depression, PTSD, other mood disorders and whatnot, what we're trying to do is something fundamentally different than the traditional use of medications and talk therapy. Now the challenge is when you're trying to describe to somebody how a psychedelic experience can work, it's very challenging, right? It's one of those things where if we could put it into words, then by definition talk therapy would have already worked, right? So what we're trying to do is actually give you a backstage pass, trying to show you something different, trying to show you the strings and the puppets, trying to show you something very different about your life, different about any psychological trauma you may have experienced and what it is causing the symptoms that you're experiencing today. So the important thing is that we have to use analogies to describe how this works. Right, so a couple of analogies I'd throw your way is one is that of like a radio. Let's say you're locked in a room with a radio, and that radio is tuned to a station that you absolutely hate. So it's a type of music you really don't like, and the volume's being turned way up. Okay, so now if I give you like an SSRI or an antidepressant or some anti-anxiety medication or whatnot, effectively what we're doing there is we're just turning the volume down. Okay, so you still hear it. You still hear that station that you hate. You still hear that music that you hate, but it's just a lot softer and it's not bothering you quite as much. Now, the problem with that is that if a life stressor comes along, the volume can be turned right back up, and then you can find yourself in a pretty bad space. Now, think about this differently. Let's say instead of turning the volume on that station down, we instead change the channel. We change it to a type of music that you like. We change it to a band that you like. At that point, everything it's a whole different game, right? At that point, you're not volume sensitive anymore. I mean, I guess the analogy does fall apart if your volume gets too loud. But you see my point, that at that point, it's a whole different thing. You're not listening to something you hate, but just at a softer volume. You're just listening to something you like. So that's part of how psychedelics work when we utilize a non-ordinary state of consciousness to show you things differently. Okay, another way to think about this is take a Western movie, right? You take a wild Western movie, a Clint Eastwood thing and whatnot, you see this town and you see the gunslingers and people wearing cowboy hats and the saloon and the jail and horses and all this kind of stuff, and you think it's the 1800s, you think it's the Wild West. Now, the reality is this is a Hollywood set. Right? So if I was to take you around the corner and show you these buildings, they're not actually buildings, right? They're just the fronts of buildings that are being held up by 2x4s. Once you see that, you can't take it back. Your whole paradigm about how you're seeing this set changed completely. So that's kind of what we're trying to do as well when we give you ketamine and we put you into a non-ordinary state of consciousness, is I'm taking you around the corner. I'm showing you that what you see is not actually what it is. So you may have had some psychological trauma. Now, as a result, you may be living your life in a certain way. You might be thinking that you have to continue to live your life in a certain way. But when I show you what's going on backstage, the hope is that you see things differently, and at that point, you just realize that you don't actually have to live your life in that way, because what you thought was reality is not reality. So, that being said, please check out our website, check out some of our other videos, learn a little bit more about psychedelic medicine and what we do with ketamine. We'd love to talk to you and answer your questions about our services at Klarisana. So check us out at klarisana.com, and we'll hopefully see you in one of our centers soon. Thanks.